Good afternoon, Enid. It's Maggie Jackson again with the Garfield County Health Department, and I'm looking forward to starting to bring you some better news. At least once a month, we're going to come back and keep giving you a health update for our community. So today, the first thing I want to share is some positive news for COVID-19. After a long year, we've got some great updates. So right now, we only have about 9 active cases of COVID in our county. So this is just a graph of where you can see the trend of the whole last year. And we are now back down to where we were last summer, which is so encouraging, especially for those of us in healthcare, to be in a more stable place. 7,806 people in our community have had COVID, or at least it tested positive. Fortunately, most of those have recovered, but we have had 131 deaths over the last year. So this virus has impacted the world. It's still impacting the world, and it's impacted our community. But we're looking up. Our hospitals have reported less people staying there, and have had 0 patients in the last week or two, which is so encouraging. We've had 305 people at least reported have been hospitalized from COVID. So things are looking up. We're just excited that in the last week, the CDC has said if you've been fully vaccinated, they're saying you don't need to wear a mask in public anymore, which is freeing for some of us who have been keeping up with wearing our masks. If you're in a healthcare setting or around a high-risk person and other situations, you want to keep wearing that mask. But we're encouraged. We think that these numbers are dropping, because so many people, almost 8,000 people have some type of antibodies in our community. It's also springtime and we're getting outside more. We're not in such closed, confined spaces, as well as a vaccine. We have had lots of people in our community have found the COVID vaccine is safe and effective, and it is really making an impact on the way the cases are spreading. So the next slide I had was a map of the state just to show us we are in green. So back in the fall, we were all watching this map every Friday to see what's our number going to be. Are we orange? Are we yellow? Concern about the community and if we needed to roll things back. So to be in green is just a great place to be at this point. So wanted to share that with you all. And then the next slide, I wanted to show you that our health department is part of an 8-county district, and we have, just through our county health departments, given out 115,000 doses of COVID vaccines. So it's been a huge undertaking the last 5 months. We've really worked hard to try our best to serve the community with this vaccine. So now almost 18,000 residents of Garfield County over the age of 12 have received at least one dose of COVID vaccine, and 72% of those are over 65, which is really important. Those are our most vulnerable people. 95% of COVID deaths have happened in people over 50. So that's the group that we really want to make sure they're protected. But getting a COVID vaccine, we are seeing more and more data that shows that it helps to not infect others. So the FDA approved Pfizer vaccine for people over 12 last week. So if you're over 12, you live with an older grandparent or a vulnerable family member, we recommend getting the vaccine to also protect your family members and those who are also nearby and might be at risk of COVID. Looking into the next school year, currently, if you have been vaccinated, fully vaccinated, so that's 2 doses of Pfizer or Moderna or 1 dose of Johnson & Johnson, and then 2 weeks have gone by since you've had your vaccine. If you're exposed to someone with COVID, you don't need to quarantine. You just need to watch your symptoms because we think you're protected from getting the virus. So encourage you to get a vaccine. There's lots available in our community now. You can go to Walmart, CVS, Evans Pharmacy, lots of our pharmacies, as well as the Garfield County Health Department. We're still giving shots every day, and you can call our phone number 233-0650 or register at vaccinate.gov oklahoma.gov. So encouraging you to get your vaccine. That's my COVID report. It feels so much better to give you some good news at this point in the year. But we are also really excited to be back into the groove of our other health services. One of the most exciting things we offer at the health department, we have a program called Sooner Start, and this is for children 0 to 3 who might be showing a developmental delay. Those practitioners are back out visiting families, and so that's exciting to see them able to really do the services that they need to help children 0 to 3. WIC has, so Women, Infant, and Children, an additional benefit coming up in June. This will be a temporary benefit, but it'll be an extra $35 for each child for the purchase of fruits and vegetables per mom and child. So this is a great benefit for a family that has children under 5 or a mom who might be pregnant. We love WIC. It is educational. Every mom that's involved learns new things about nutrition. They learn how to make healthy recipes, how to shop for groceries, and how to make the most bang for your buck. So if you know someone that is qualified already for SNAP or TANF, they automatically qualify for WIC or Medicaid. If you know someone on Medicaid, they qualify for WIC if they're a mom who's pregnant or has children under 5. So I just want to highlight that program because that benefit, that's, COVID has had a lot of impacts on our community other than, the actual health virus. We've had people losing their jobs, having a harder time with childcare, being out of school and things like that. So we know that if a family has a little extra help with food, they're learning how to prepare healthy food on a budget. This is, one thing that can help them with other areas of their life. So spread the word about WIC. We love it. We love Whitney, Joy, Mindy, our WIC team. They are so kind and fun. They love their clients and they want to talk to you. They love helping our community. So you can also just call 233-0650 or you can sign up online, and I'll share the link on our Facebook page again. So we're looking forward to summer. Lots of ways to get out, be physically active. I know I'm really excited to go to the Buzz Run, the BFIT Kids Buzz Run. If you have kiddos, get them out there and try some time on the track. And let's all get out and be healthy, build our immune systems, and have a great summer. So I'll see you guys back here in about a month or so, and we'll have another hopefully positive health update. Have a great weekend.